Levi here, welcome to the channel. This video in this series is about addressing excessive internal rotation of the knees. Essentially it's internal rotation of the femur, but you'll see it in the knees. So this video is about bringing neutrality to that joint. So bringing neutrality to the internal hip rotators. So the assessment for this piece is either having a friend look at you or looking down at your knees yourself. A little disclaimer is the way it appears on the camera, you might not really be able to tell whether my knees are pointing in and out. So trust your process at home. So if I were to march it out and look down at my knees are fairly neutral. I wouldn't need this stretch, but if your knees are looking really turned in, or you can tell that the kneecaps or the thighs are pointing inward, we're not looking at the toes. We're not dealing with pigeon toes, because there are people who are pigeon-toed knees forward, and there are people who are straight in their toes, but knees are in. We're only looking at the direction your knees are pointing. So again, if they're pointing in, and generally that will come with a posture of the hips kicked back a little bit, knees pointing inwards. It is more a traditional pattern that I see in the female body because of the way that the hips are oriented. But no matter where you stand with that, we're really just going based off evaluation. So if your thighs and knees are pointing in, this move is for you. So join me on the floor. Here's what we're doing with this move. I will say if you find one knee pointing in and the other one's neutral, we are going to put together a separate video to show you how to address it. It's going to be basically doing the same move, but really just engaging the one leg that you need addressing. So our position for this is lying back, bent knees, feet together, knees together. And when we go up on our in-breath, we're going to lift up our hips. Remember, if it's a bucket of water, we're spilling the water out the back of the bucket, which means squeezing with your glutes up, belly button down. What we're going to do for this one is we're going to drive our knees together, like I'm trying to squish something here. So if you're trying to crack a walnut or any sort of like pistachio or something, you're trying to squeeze it. So breathing in, hips up, knees together, squeeze. As you breathe out and relax, relax into an open hip position. Breathe in, squeeze. Breathe out, relax, open. Now I'm gonna add one thing if your body feels comfortable with this. Breathe in, squeeze. Breathe out, and I want you to press your thighs and hips back towards the ground as long as you can keep your abs in. If your abs are trying to come up, then don't do it. If you can keep your abs engaged down on your out breath, draw your knees up. Breathe in, draw them together. Breathe out, knees out. Stand up, walk around. I'd say do this between 3 and 10 reps, enough to feel it create a change in your body. You'll walk around 30, 40 seconds, let everything situate. Essentially the walking around is any fascia that we freed up in the move can effectively distribute itself where it best serves your body now. And what you can do is take a look back down at your knees and see if there's any change. See if they've become more neutral. That would be the goal. And if you're feeling better in your movement, and you see the assessment has been proven beneficial, then this is a really good self-care piece for you. Leave some questions, leave some comments if you have things that you're still trying to figure out how to engage it. I'd be really happy to help and answer those. And I will see you in the next video.